Welcome to Speak from the Body, a podcast that seeks to explore the wealth of wisdom of the body. My name is Avni Trivedi, and I'm your host, as well as an osteopath, doula, and movement teacher. In this podcast, I speak to experts about all sorts of topics to do with the body, such as touch, trauma, body confidence, gratitude, birth, movement, relaxation, and baby development. My wish is that you learn how to connect with, listen to, and respect your body. Today's episode is with Laura Schikkerling. Laura is a dental hygienist with a holistic approach to mind-body health. She offers a mindful approach to caring for the teeth, mouth, tongue, and gums for greater confidence and health. Hailing from South Africa, Laura now lives and works in London. In usual circumstances, Laura spends many months of the year at an ashram in India to support her personal practice and improve the lives of her clients. I'd like to welcome Laura to the podcast. Thanks for being here today, Laura.
Avni, thank you very much for inviting me. It's been a pleasure to know you. So it's nice to be here with you.
I've been lucky to come to you for dental hygiene appointments for quite a few years now. And I, in all honesty, used to think that dental hygiene was, or the appointments were just, how shall I put this? Because I didn't grow up having them. It was a case of going to the dentist a couple of times a year. So I always thought it was a bit of an extra. And I've really learnt a lot from coming to see you compared to other people I've been to in the past. I'm curious to know, why did you become a dental hygienist?
Well, that's an interesting path because it's not something I thought I was going to set out to do. I literally took a job in my summer holidays at school, and it turned out to be with a periodontist. And the first day I was there, his nurse didn't turn up, and he asked me to come and assist. And I was so intrigued with the way he operated. I didn't even know what a periodontist was at that stage, and it's a gum specialist. And his name is Dr. Volkansky, and he's still a professor at Wits University in Johannesburg. And I was planning to come to England, and he told me about a dental hygiene course. So that set me into it. But I think the fascination really was recognizing that the era in the 50s, there's a lot of fear around dentistry. And this presented a much kinder way of empowering a patient rather than they're seeing a dental appointment as an invasive thing. It should be a supportive role as part of one's health.
That makes so much sense about the fear, because I know how many people avoid going to the dentist because they get scared or they've had bad experiences with lots of dental treatment when they were children and things, and that has an impact. How early can, say, babies or children start to learn about the importance of taking care of their teeth?
Almost immediately, Avni. As soon as the teeth come into the mouth. And I think a very big part of this, and this is more the psychology of it, is that the parents are supportive, that they are setting good examples, and that they don't create a sense of fear around the mouth. I've seen patients or parents bringing their children in, accompanying their children, and as soon as I put a mirror in the child's mouth, the parents cover their eyes and go, "Oh, I can't even watch." Now that sets up such a process of fear in the child. So, it's part of making a child feel that it is looking after their teeth is the same as looking after their diet. So from very young. And I think a good idea for parents is to take a young child, almost from newborn, with them when they go to the dentist, so that the child from very young sees all the equipment and isn't overwhelmed when they themselves have to go and see a dentist. I think the average dentist definitely would immediately invite the child to have a ride on the chair, or to switch the light on and off, or maybe give them a mirror to look in their mummy's mouth, so that the whole thing is normalized.
And the boundary of going into the mouth is quite a private, personal, intimate thing, isn't it? I mean, I sometimes work intraorally, particularly with babies, And it's something to really honor, that you're going into someone's private space. So
Yes.
that needs to be kind of respected and acknowledged.
Uh, Absolutely. And I think one of the key things for any dental practitioner, and anyone who's listening to this, I'd say to mention exactly that to the patient. You know, I very often will cup someone's face before I start working and just say, so we're going to have a look at your teeth now, and just give them a sense of the fact that I am aware that it is a very private space. And also, I think in taking a medical history, one of the things I like to end with, the last question I will ask, is I'll say to someone, "Are you happy?" And invariably, they might make some comment about, "Well, right now in the chair," and then I'll become aware that I need to draw them in a different way. You know, or they might suddenly tell me something about their work or their marriage or whatever, and it's all relevant. The moment that awareness occurs, gives me an insight into how they are connected to their mouths in a way, because you know this is one of the things that is becoming more evident now, where medicine and dentistry are marrying more, but traditionally they are two separate professions. Doctors never look in a person's mouth, and often there are conditions, gum conditions or whatever, that are affecting the health of the person. So I think that, you know, to recognize dentistry as part of general health, and to encourage a person to feel that it's a maintenance, it should really be almost a cosmetic experience. I do try and encourage people to feel going to to a dental hygienist is really about taking care of themselves, not being invaded by an outsider, if that makes sense.
Yeah, and you mentioned about the link between oral hygiene and the rest of someone's health and well-being. So what are the kind of things that taking good care of your mouth?
Well, it's a gateway to the body. And I think the most dramatic thing for a person to be aware of is that everything that keeps you alive has to come through the mouth. Every job of work you get will probably be because of your communication. Every love affair you have, you'll be kissing someone. The mouth is central to that whole hierarchy of needs we have: our shelter, our employment, our nutrition, and our love. So when there is a sense of a lack of confidence around the mouth for whatever reason, that impacts on someone's emotional health. And our emotional health affects everything, as you well know in your profession. So, you know, it's really interesting for someone to start to honor their mouths. I often say to people, I prescribe a love affair with your mouth. Fall in love with your mouth. Recognize that every aspect of your mouth has a memory. Your teeth are formed when you're very young. The first teeth are formed in the first trimester. So the teeth have a memory of everything that's happened to you. And the neural pathways that retain the memory even of the teeth coming through, which it can be painful for children, for babies. So the mouth is incredibly central to our self-awareness. And I almost want to say, unfortunately, because there are so many methods of suppressing pain, general pain, as well as dental pain, so things that desensitize or painkillers or anti-inflammatories, that might take away the symptoms of what's going on. But the deep body intelligence knows when something is amiss. And the first thing that happens is that the central nervous system goes out of kilter then. And in neuroscience, they're showing that so much more now, that as soon as there is some sense of the body being attacked, and inflammation is a form of attack, and inflammation is the first thing that happens with a soft tissue with a gun, that the body goes into a slight state of fight and flight. And as soon as that happens, the ability to rest and digest is suppressed. So the mouth is, and I mention that specifically because the most common place to get inflammation is the mouth. because it's the one area that is receiving all sorts of foreign things, different types of foodstuffs all the time. And people have habits of chewing a pen or sucking their thumb. And all of that is introducing bacteria and a change in the pH in the body, which affects the whole microbiome. And the gut connection to the mouth is enormous. I often say to people a little bit crudely, remember that the tissue in your mouth goes all the way through your body to the other end. So when something is affected in the mouth, then the whole passageway is going to be affected.
You were saying to me at my last appointment that it's good sometimes to brush your teeth without any toothpaste, just so you can see the inflammation that's a good early sign, isn't it? If you're getting blood that quickly.
Yes, very much so. But the toothpaste obviously has a very good effect. But personally, I've always brushed my teeth. My first brushing is with no paste. Not only because it makes me more aware of where there are food traps, because as soon as you put toothpaste on your brush, it deodorizes the whole mouth. So it disconnects one a bit. One doesn't recognize that food is trapping somewhere because you can't taste it. And as you said, if there is inflammation, when one puts a little bit of pressure on that area, the tiny little blood vessels will pop and there'll be a little bit of blood in the mouth. And in a sense, if the gum bleeds, there's nothing wrong with the gum. There's something wrong with the cleaning. The gum is responding correctly. It's sending extra blood to the site because it recognizes some bacteria. So to brush with no toothpaste keeps one more in tune with the areas where food is either smelly and trapping, so you know where to concentrate, and or the taste of blood. So I always, if I see blood on the toothbrush of a child when I'm brushing for a child, I'll show it to them and I'll say, oh, what a clever mouth you've got. It gives me a red flag to show me exactly where your breakfast gets stuck. So let's get in there, clean it all out, and then that red flag will stop coming, so that they don't have a sense of fear, or because we associate blood with injury. But in the mouth, it's because it's swollen up to draw our attention to a place where food is trapped. Also, not using paste, certainly I always feel as though it's a bit like cleaning, sweeping an area. You'd remove all the debris first and then you'd put polish on. The toothpaste, I think, should be done knowing that the mouth is now free of any gritty stuff. And then you apply your toothpaste and do a more meditative practice, if I can put it that way, which is another subject which we can go into in a moment.
I'm glad you said that. I was going to ask about the meditative practice, because that's one thing I really like. Of each time I've come to see you, I've come away and really pay much more attention when I'm brushing, and not just as I've got to brush my teeth, but it's a moment of presence, which feels very different. It feels very connected.
Yes. Well, that has multiple roles in a way. The first is the sense of respect. Now, the relationship we have with ourselves, and certainly with our teeth, affects the way our emotions operate. So if one immediately, on picking up the toothbrush, uses that as a cue to really go into a respectful moment where you think, right, this is the area of my body that allows me to receive all my nutrients and that gives me my ability to communicate. And I'm going to do this with some respect. But also, one of the things that could be interesting if someone really wants to get into the relationship of the mouth to the rest of the body is maybe to have a look online. And there are lots of resources online. One has to just be careful not to get into unnecessary stuff. But if you can look at a chart and you just write the relationship of teeth to organs, a chart will come up showing which organs are related to which teeth and which emotions are. So that's very useful, because one can then literally, as you go from tooth to tooth, have an awareness that you're in a way doing a full body treatment by addressing that tooth with some focus. You are transferring that energy to the whole body. But as a separate practice, mindfulness in itself has been researched extensively now, And there's a great awareness that after just 6 weeks of mindfulness practice, there's a 30% increase in the use of grey matter in the brain. And that's based on 20 minutes a week. So I'm suggesting to patients to do a good 6 or 8 minutes every day of mindfulness practice. They use that, as I said, as a cue. The moment you pick up your brush, just think, I'm going to zone out completely and just be observant of myself. How are you standing? Are your limbs stacked? Are you comfortable? Have you overgripped the toothbrush? Are you grimacing at yourself? And just are you breathing? Are you comfortable? And then be conscious of which tooth you've placed the brush on. Having said that, knowing the monkey mind, by then one's probably started a shopping list or an email already. And you have to just bring your mind back very calmly. No. We're cleaning the teeth right now. And just come into this really respectful mode of recognizing that the cleaner your mouth is and the more loved it is, the better your nutrition is going to be. And then we need to move on in a way to how to clean. So that's a really important aspect. We're talking more around the emotion of it, but a lot of people are literally interested to know, how am I going to keep my mouth healthy? So firstly, one of the things I often suggest to parents is almost to ban the word toothbrushing. There are two sort of problems with that. The one is that it implies that the tooth surface itself is dirty. Now, if you think about that, if you rub your finger across your front teeth, they'll probably squeak because the enamel is very smooth and nothing will adhere to it. So the food is not sticking on the teeth, on the biting surfaces, granted, but generally on the tooth surface, the food slides off the tooth and nestles alongside the gum and gets trapped between the teeth. So it's a gum line cleaning. It's using your toothbrush to seek out little nooks and crannies where debris could be lurking. So there, brushing becomes a rather aggressive word as well. And it's used in most languages. They always say, brush your teeth. Now, brush traditionally is something that you scrub with or that you sweep with. So it makes the movement that one uses too big. Whereas if one starts to do a really fine movement, almost placing the brush in one place and then jiggling it, it's just this finest movement to see if there's anything trapped between the teeth. And as a secondary effect, when the brush is touching both the gum and the tooth as it ought, but with no scrubbing action, this is the problem, that there's so much controversy about how much pressure to exert. And the simple way to recognize that is that one should exert just enough pressure to see the bristles of the toothbrush splaying and becoming the shape of the tooth. The tooth is not flat, it's convex. So one wants to address the whole shape of the tooth. So just enough to see the bristles assuming the shape of the tooth and simultaneously observing that the gum goes ever so slightly paler. So just see that there is some stimulation taking place. Never mentioned. That's never mentioned. The gums love massage. Every part of the body loves massage. Our entire body is 100% dependent on blood circulation for the delivery of not just oxygen and nutrients, but hormones and enzymes and instructions and, all sorts of juices are running through the blood. So unfortunately, our gums in a way are becoming a little underwhelmed because our food has become so much softer that the area is understimulated. So it's a bit like wearing shoes all the time. One's feet go soft. Well, that doesn't matter. We can wear shoes. But in the mouth, sometimes we do need to be a little more aggressive to shift nuts or seeds or whatever. And if the gum is very tender, one won't be able to do that. So, and I keep mentioning gums, and I know everyone thinks the whole mouth is full of teeth. No one ever says, oh, you've got nice gums. It's always, oh, you've got nice teeth. So it's a sort of poor cousin of the mouth, and yet it's the supporting structure. The teeth can be really solid, and you can be born with good, healthy teeth. So there is some genetic value in the tooth itself, but there's no such thing as inheriting good or bad gums. There is some controversy with that, but generally the health of the gums has a lot to do with the cleanliness of the mouth. Nutrition, as a separate subject, is going to affect both soft tissue and hard tissue. And that is such a vast subject that, if there's anyone listening that is particularly focused on that, I would suggest looking at a book called The Dental Diet. It is an excellent resource, and it gives one a much broader understanding of exactly how nutrients affect not only the soft tissue, meaning all your skin and your gums, but also the bones. And then the tooth is regarded as part of the skeletal system. And in the event of acids being excessive, the pH being incorrect, the body will start to leach minerals from the bones and from the teeth. So the teeth will be affected by diet, obviously, but the gum will as well. So diet is an enormous part of everything in the body, but certainly the mouth.
I'll link the title of that book, so thank you for that.
Yes.
There's often the examples used of people in kind of more traditional cultures, or kind of, in inverted commas, primitive cultures, where they'll still retain all their teeth that are healthy and strong until later life. Whereas from a kind of standard Western diet, where there can be high sugar and high numbers of processed foods, people would be losing their teeth and things. So is that just coming down to nutrition, or because, people wouldn't have access to the kind of the high-tech side of things from a dental care point of view?
A bit of both, and that's a very relevant question. Traditionally, in developing countries, one of the most common cleansers were various types of twigs, neem being one of the most common ones, where people would chew various twigs and plants in order to cleanse the teeth. So that partly the herbal effect of that, but also the cleansing action. But as you say, the diet had an enormous effect on that. I grew up in South Africa, as one can hear. I spend a lot of time in India as well. I work at an Ayurvedic center. And the reason I started doing that actually is that I thought dentistry was very limiting, because my interest was growing into a much wider aspect of general health. And I got involved with yoga therapy and Ayurveda to sort of move away from dentistry. It was really funny because it drew me straight back into dentistry. The enormity of how important the mouth was regarded in Ayurvedic medicine 3,000 years ago, between 3,000 and 5,000 years ago, when all the Vedic sutras were created. And there's a whole section on tooth care 3,000 years ago. So the awareness of the mouth and the fact that it is the entry into the body was way better understood thousands of years ago. As we have gradually introduced refined food, and unfortunately the food market has extended to developing countries, and in a lot of cases thinking that they with good intention that they're doing people a favor, but unfortunately refined food and food that could be transported, that has lost its vitality, is what became very popular. So there's now quite a decline in dental health in Asia and in Africa because of diet. And also because once one starts using chemicals that change the smell of what is happening in the mouth, we start to get a little bit disconnected. There's always been an awareness of having a fresh breath, but previously you'd chew cloves which have a lovely effect on the rest of the mouth and the teeth. So the effect of what is happening in dental marketing, and as we know, everything is sort of being medicalized now. Falling pregnant is a medical condition. A tooth coming through is a medical condition. So I think that as much as I really encourage people to look at resources, and there are many resources, I'll mention one or two a bit later as well, one needs to also look sometimes to one's internal wisdom and to really stop trying to be like other people and follow fashion, and really have a sense of what is important to you and what feels right for you in your own mouth. Certainly cleansing is one of the most important things. But equally your diet and your attitude towards your mouth. Our first contact with people that really can make a difference is a smile. Endorphins are produced. To smile at someone really makes a difference. And when people are not confident of their mouths, they often attempt to hide their teeth, or they won't smile. And so it affects us socially, it affects us emotionally, it affects our deep general health and our dental health.
I wanted to go back and ask more about Ayurveda, because I know that for many months of the year, normally you'd be in India. Do you incorporate some of the Ayurvedic practices like oil pulling and tongue scraping and things into your practice? Or
yes, I do indeed. And when I was talking about the cleaning the teeth, I wanted to extend onto that. So thank you. That the cleaning the tongue is also very important. And I think people talk about the tongue scraper. That can sound a little bit aggressive. You get a tongue cleaner, but one doesn't want to be too aggressive with the tongue. And one can also use one's toothbrush, a soft toothbrush, by the way. Toothbrushes should always be soft, because when one's cleaning the teeth, one always has to be including the gum line. So the toothbrush will be touching gum and tooth simultaneously. If the brush is too hard, one will be disinclined to do that because the gum won't take that. So soft brush anyway. And then one extends to brushing the tongue. Right at the back of the tongue, the little papilla, so the little dots that cover the tongue, the little cells, the ones right towards the back of the throat are mushroom shaped. So it's quite easy for plaque or the biofilm to form under there and create a bit of a bad breath as well. So tongue cleaning, which comes from Ayurveda, oil pulling as well. Again, I would ask people to listen to themselves. Traditionally, coconut oil is used. Some people don't like it, and often what we have an aversion for doesn't agree with us. There isn't a silver bullet ever, and one system doesn't suit everyone. So sesame seed oil is an alternative. But going back to Ayurveda, in the Danta Vedas, the dental Vedas, the first thing that is considered is the constitution of the person. So a regime for the health of a person would be based on their constitution. So, and without going into in depth of how that's established in Ayurveda, but it is a very good example of the fact that is not something that happens so much in modern medicine. People are not looking at individual constitutions, and by constitution, I mean a number of things, not just what we see as their resilience, but their skin type, their coloring, their bone structure, their desires for sweet or sour. There are lots of things that create an individual aspect in a person that would require a different treatment from someone with a different build or different constitution. So again, there are very good resources to do with Ayurveda, and one of them is literally, if one looks up the full title, Oil Pulling and Ayurvedic Practices, a scientific paper will come up, which I'll email to you later if you want to put that in. That is very relevant. Homeopathic practices can also be interesting. And again, if one wants to look at some of the homeopathic preparations, and one of the very good practitioners or suppliers in this country is Nelson, as in Nelson's column. As far as looking up homeopathic preparations, it's an American site, but it's very good, and that it's Kaiser Permanent. So that is Kaiser and permanent, but with an E at the end, organization. And if you type in homeopathic remedy for toothache, it'll come up with all the different types of toothache that there are, and what the look is of that person, and whether it's better with cold or with hot. So a bit like Ayurveda, it's one size does not fit all. It will depend on how that condition is manifesting as to how it will be treated, either with Ayurvedic preparations or with homeopathic ones.
So interesting, and it makes so much sense. And a lot of the thing of everyone should walk 10,000 steps a day, everyone should drink 2 liters of water a day, all those things that are so general aren't personalized to us. So it makes so much sense to bring it back to our individual response.
Definitely. And something else I wanted to mention is where people are maybe looking at a more biological dental practice, or way of looking at the body as a functional practitioner would do. Again, to research that quite carefully. Another resource that can be quite good with regard to biological dentistry, and if people are interested in that, they would already know why they are. So I'm not going to pursue that because it's quite controversial. But the name of the book is Let the Tooth Be Known. Not the truth.
Great title.
The tooth. Yes, it's great. So that is everything you need to know about how to find a biological dentist. And the sort of people who would be looking at that would be where people have a sense that something in their mouth, maybe a condition that they've had in the past or a restoration that they have, is affecting their general health. And then, one could pursue that. Going back to children's health care, dental care, the awareness of people knowing what is going on in their own mouths, I think, is also quite important. Very often, I will have patients who will tell me that they've never actually looked into their mouths, not opened their mouth wide and examined their own mouth. That's possibly slightly British, this lack of self-examination. There is something going on with that. I often say to people, how many teeth do you have? They have no idea. Then it's really interesting. We're so reliant on our mouths. We know we've got 10 fingers and 10 toes, absolutely no doubt. But usually people don't know. And I don't mean as an exercise of your biology. I mean you as an individual. And were wisdom teeth removed? Were any teeth taken out? Now I just find that really interesting that often people don't know how many teeth they have at all. Another thing that seems to occur a lot in the UK, and I've spoken to other practitioners who've worked in several countries, and it does appear that tooth grinding is happening a great deal more generally, but it does seem to be quite a phenomenon here. It might have something to do with the stiff upper lip, and being a bit contained, and there are dozens and dozens of micro muscles all around the joint of the jaw, that what we call the temporomandibular joint. And every time we don't want to scream, all these tiny little muscles come into action. So that is happening a lot more than people realize, that they're tensing and gritting their teeth in an attempt to deal with day-to-day stuff. And that can have a lot of implications as well. It can affect all the little nerves that activate the mouth, all around what is called the trigeminal nerve, the three main branches of a nerve that run from just below the temple to the upper jaw, the lower jaw, and up into the sinus. So if that gets stressed, it can result in quite a lot of referred pain. Also, tooth grinding can occur from drugs, both medicinal and recreational, which people don't always realize. So the incidence of grinding in any stimulant, in cocaine or meth or ecstasy, you'll often see that people are grinding. And the other important thing for people to realize with medication or with smoking is one of the reasons that can be so damaging is because the reaction of the gum is reduced. It's literally drugged. So where a person would get inflammation if there was some food trapped somewhere, in someone smoking or taking certain types of drugs, that will be suppressed. So it's even more important for someone if they're taking or need to take something, or they're still with a habit, to become very vigilant and observe what's going on in the mouth. So to be a step ahead of that cigarette, to be a step ahead of that prescribed medication, and examine the mouth, notice if there are changes taking place, and usually just by looking at what one has been eating and how one is cleansing. And it's very empowering too, because a lot of the fear of a side effect of a bad habit or a necessary drug compounds the issue. But if you informed and look out for little food traps and be aware that you're not going to get inflammation as readily, be aware that you dehydrate more readily, and keep sipping water. So there are lots of little things that one can use to assist one if one is in a situation of having to take medication or having a habit that one hasn't broken yet.
I wanted to ask you about fluoride.
Sidetrack.
I wanted to ask you about fluoride, because that's a topic within the kind of more integrated or natural health world. Often it's quite anti having fluoride added to water or to our toothpaste, and choosing a fluoride-free toothpaste. What are your views on the situation? Because it's quite complex.
Avni, that is such a controversial subject that it's something I would really, again, ask people to look into themselves, to really try and make a decision from within themselves. In the dental profession, we are taught that fluoride is preventive and that it is a good thing for the teeth. There are schools of thought that do not believe that at all. There are schools of thought that are aware that the desensitizing the surface of the tooth, which fluoride pastes can make the teeth less sensitive. There are schools of thought that there's an awareness that if that is happening in the body, it's happening in the mind. Does it make one less sensitive as an individual? So there really is not enough evidence against fluoride for me to get into a big discussion about that. I think having anything that is excessive can be problematic. I think that if one is unsure and going more towards alternative health, is to maybe go to a kinesiologist, a person who does muscle testing, to establish what substances are suitable for your particular body and constitution. So, as a practicing dental hygienist, I will say that I find that a little too controversial, to be honest, to go into a long discussion about that.
Yeah, no, thank you. No, I appreciate that. That's really pragmatic.
Yes.
Thank you.
Thank you.
Going back to cleaning the teeth, I'd like to ask about mouthwash, because that's another, like, there's this kind of whole shelf full of products that get sold now for dental hygiene. And, are they a nice to have because it's nice to have fresh breath, or are they a good thing?
A very broad way to answer that. Firstly, if the mouth is kept clean, and mechanical cleaning is really the only way that one is going to clean adequately. A chemical will not make food debris vanish into thin air. It's not possible. It might deodorize, which is a bit like using a deodorant instead of bathing. So, that sort of addresses that side of it. But as far as mouthwashes are concerned, I'm going to mention a webinar that I listened to quite recently. And it was a periodontist who specializes in gum conditions. And he was saying, and in the event of your having any inflammation or post-operative work, hot salt water, a teaspoon of normal salt, or actually a good quality salt, an excellent mouthwash. It's been seen over 20 years. It is as good as any mouthwash. And then you could literally see him wanting to eat his words, because the sponsor of the webinar makes a mouthwash. So that was quite,
that was his fee taken away.
that was quite amusing, but he did say it. And there is also a great awareness that there are a lot of bacteria in the mouth that are essential. And some of the mouthwashes are a bit broad spectrum, and they're removing bacteria that we may well need for digestion. We don't even know what all these bacteria are for. So it's a little bit rude to wipe them out when you don't know what they're for. So ideally, one wants to remove the host that evil bacteria could breed in. And to put it in a very plain sort of way, bacteria that would make food decompose can attack us. Our gums are made of meat, if you think of it like that. So any food particles left in the mouth, if the mouth is a warm, wet place, they're going to attract inappropriate bacteria. So remove the host, remove the food debris. Now, biofilm, one does want something of a biofilm on the teeth. So to constantly be washing that away, and even a very frequent eating is one of the things that is not ideal. To just change the subject away from mouthwashes, because very often people who are snacking a lot are afraid that they'll have a bit of bad breath, and then they use mouthwashes, and the body gets so confused, because for a start, the digestive process does take some time. So if one is only halfway through digesting something from an hour ago, and now you're snacking again, the body's trying to work out what to digest, what to eliminate. And from an oral health point of view, you are loading the mouth with more and more debris. So in a perfect world, one should to eat at meal times and not be snacking in between. And because then one won't have a sense of needing to freshen the breath all the time.
Yeah, that makes so much sense. And when you tie it to digestion,
yes,
it's part of healthcare rather than just a kind of an add-on thing to do. I had also another question about electric toothbrushes, because every time I come and see you, I'm always checking in. Is it okay still if I don't use an electric toothbrush? Because that's my preference. And I think for me, I don't know, there's something of the sensitivity from too much of that vibration that just doesn't feel good in my own mouth. So that's one of my reasons for not using them. But what are your thoughts on a manual toothbrush versus electric?
Generally, I will say to a patient that I like the brush that they like, because that's what they're going to use. If someone really has an aversion to one or the other, I'll rather teach them to perfect the use of their preference. Having said that, personally, I use a manual toothbrush, by the way, but having said that, one of the advantages of the electric toothbrush is that the head of the brush is always small. When the manufacturers decided on making an electric toothbrush, they really listened to what dental university hospitals were saying. And it's a small brush and not a hard brush. And the reason one wants a small brush is that when you do the insides of the teeth, so the areas behind all the teeth, it's much more restricted. On the lower jaw, the tongue is in the way. On the upper jaw, you've got the narrowness of the roof of the mouth. There isn't a lot of space to work. So ideally, you want a small brush so that it can fit in. Also, when you go to the very back of the mouth, the larger a brush is, the more likely you are to activate a gag reflex. But also, if the toothbrush is quite long, one would be touching several teeth at the same time. And then which one are you actually focused on? So to do one tooth at a time, and the traditional original electric toothbrush was round. And that's a lovely design because the tooth is round. So it embraces the tooth. And it's interesting that they've not made a manual brush that is round. And if one wants to be a little aware of marketing, you'll realize that the same people who make electric brushes are making manual brushes. And they often make them big and they often make them hard. And what happens is that in the end, a dentist will say, I see much better results with electric. A big part of it is that they're always small and they're always soft. And the psychology of it is that they're quite expensive. So people want to see a result, so they tend to use the electric brush more. Personally, I also find the vibration a little odd, and I feel more in control with a manual brush. But let the brush be small. And if you can't find one easily, go to a privately owned chemist and ask them to stock it. Just to go into another aspect of our lives and our environment, as the mouth is part of our body environment, we are part of another environment. And let's try and support small businesses and ask people to stock the things that you like. And in a toothbrush, it should be small and soft and replaced every 2 or 3 months. The very seldom discussed is the cleanliness of toothbrushes. And I frequent to bring their own brushes in, especially electric, so I can use them in their mouths to demonstrate pressure. And I would suggest to any people who are listening to this to ask their hygienists or their dentists to use the brush in their mouths, because it's very difficult to describe pressure. It's better to feel it. So you can actually ask your dental health practitioner, bring your own brush in with you, and let them give you an idea of how much pressure is required. But they must be kept clean. Going back to Dr. Volkansky, who I originally worked with in South Africa, he just recently published a paper on decontamination of teeth, and that the stuff that is found in a toothbrush, staphylococcal infections, strep, fecal matter, because people keep their toothbrush in the same room as their toilet, and they're using the lid before they flush. And it's really interesting how it's just never considered. We just don't think of how incredibly unclean a mouth is. So you don't want to keep using the same toothbrush over and over again, So I quite like not very expensive manual brushes, so you replace them quite often. And if you look at a brush, if you turn the bristles away from yourself, be electric or manual, if one can see the bristles splaying out, that brush is not useful anymore. Because the bristles they should be really quite perpendicular to the shank of the toothbrush to be effective. But also they're probably, the bacterial load in a toothbrush is terrifying. So what I would use a mouthwash for is to sterilize my toothbrush rather than put the chemicals in my mouth. Vinegar also, putting your toothbrush in vinegar overnight. Occasionally I use hydrogen peroxide. And I have 2 toothbrushes on the go. I let a brush dry out completely. Quite a lot of evil bacteria can breed on a brush. So when you've finished brushing, rinse it thoroughly and stand it up so it can dry out. And Maybe if it's not dry, when you want to reuse it, have a second brush on the go, maybe.
I think I've learned a bit too much
Sorry.
about a dirty brush.
I saw your face like, ooh. Yeah.
I wanted to also ask you to talk about the hand positions, because that's something I've learned quite a lot from you, of when you're moving into different parts of the mouth, how you're
Yes,
using your hand to
yes, yes,
accommodate.
yes. And that's with as we're talking, and you can't see what I want to say. Um, I would say one of the easiest ways to establish that you're reaching, particularly the backs of the insides of the teeth. You know, they're on their outside. The trick is to position the brush and work in a pattern. So position your toothbrush on the very last tooth at the back. Hold it. The little mantra that I like is find the gum line, embrace the gum line. So you put a little bit of pressure on it, and then for the slow count of 3, do it fine movements, like a tiny little jiggling action, and then slightly lift the brush and then embrace the next tooth. So and have the shoulder relaxed so that you're not tiring. So you'd work around the mouth like that. When you want to do the inside, sometimes it's really difficult to ascertain if one is touching the gum line. So it's actually worth taking the forefinger of your hand that's not holding the brush and feel where the tooth lies. I call it digital imaging. Use your digit, your finger, to create an image in your mind of where the tooth and gum meet, and then position the brush. So really feel the inside of the teeth, and you'll memorize it quite quickly. But have a sense of where the gum and the tooth meet, so that your brush is touching the gum and tooth simultaneously. It's so not toothbrushing. It's gum line cleaning. So make sure that you're positioning the brush correctly.
Thank you. That's really helpful. Was there anything else that you think people listening should know about taking care of their teeth and gums and mouth and tongue?
I think we've covered most things, but I do think that the falling in love with your mouth is really important. You know, I think that one needs to look at it and recognize how important it is, how you feel about it. I think comparing to other people is really not appropriate. There is such an awareness of Hollywood white teeth today. And that it's just become excessive. Teeth have different colors to some extent. So I think it's more important that one gets to understand what is important in the mouth, and if the teeth are not meeting correctly and you're not being able to chew correctly, then it definitely it is important that one has a look at alignment of teeth. I think in osteopathy and in chiropractics, they will often say that the temporomandibular joint really dictates the whole shape of the spine, almost talking about that as the first part of the spine today. So if one thinks of a teaching skeleton that's hanging off a jaw, if you tilt the jaw in a certain way, the whole spine changes. So the alignment is important, not just from an aesthetic point of view, but from a functional point of view. So it's not just about looks. Yes, one does want to have a pretty smile, but the combination of the teeth being functional and healthy, so that you're not polluting your food before you're swallowing it, are the two key factors.
I have to actually, before we finish, I've got to ask about flossing as well, because
Yes.
it was something I wasn't doing very much of
Yes.
before I started coming to you. And
so flossing is the floss usually means the string that one uses between the teeth. I think flossing has become a verb now, meaning cleaning between the teeth. So cleaning between the teeth, or interdental cleaning, is definitely something that is necessary, in that our diet has become much softer. A lot of our food is harvested much younger. It's become fashionable to have tender meat if you're a meat eater, or tender vegetables, young vegetables. And that's not, never mind all the refined foods, that tends to disintegrate all of these things if they're not very fibrous. will get into nooks and crannies where the tongue can't feel it. So often there's food trapped between the teeth that the tongue is not detecting and the eye can't see. So as to what one uses between the teeth depends on the space between the teeth. So flossing using a string floss would be appropriate. Two teeth are very close to each other and you can't fit a tiny little interdental brush between the teeth. There are, again, as you said earlier, so many products on the market that it is really worth asking your hygienist to tell you what size brush is required between each of the teeth and which teeth could only possibly be flossed. It's important to know how to floss. So the floss should hug the tooth. The tooth is round. So as you position the floss between the two teeth, before one gets anywhere near the gum line, one should put a lateral pressure on. So you're hugging the shape of the tooth. So the floss becomes sort of C-shaped. And then the action is quite gentle as you go down, but it's like almost like drying your back with a towel. So you'd go up and down, cleaning, going slightly under the gum, and then coming up again above the little apex of the triangle, the point of the triangle, and then select the opposite two and descend the other way. So flossing correctly is very important. Another alternative is a water pick, which is a water flosser. That is a little instrument that ejects pressurized water. Again, that works best if there's sufficient space between the teeth. If two teeth are slightly overlapping, that pressurized water is not going to be able to push anything through between the teeth because there's not a space between the teeth. So again, one size does not fit all. So it's really worth trying to figure out the different sizes between the teeth. Teeth are never equidistant. So different teeth will have different spaces between them. I think it really is worth asking a dental professional exactly what size product should be used between each of the teeth.
And again, it's interesting to hear just how personalized you are to each tooth as well. It's not just the act of flossing or cleaning between the teeth. It's
every tooth is individual. Mm-hmm. And one of the lovely sayings that I stole from a patient once, I was demonstrating brushing for a very, very famous actress, an older lady. And she was looking at me a bit oddly, and I thought I've really offended her. It's a very personal thing to brush someone's teeth for them, because I said, let me show you the correct way to brush. And I stopped and I said, are you okay? And she said, oh, darling. She said, that's exactly how I clean my jewelry. Why would I clean my teeth like that? And I said, I'm going to nick that expression. It's great. So think of it like that, and that's one of the things, I met you at the Carnaby Street Dental Practice. And we do treat quite a lot of famous people. And I love quoting that. I always say, who was the actress now? So I can't tell you that. But it is interesting for that awareness that it's something that valuable and that each tooth is like a gem. It's a different shape, and treat it with that respect.
That's a lovely note to finish the conversation. So thank you so much for talking to me today.
It's been a pleasure. And thank you very much for inviting me. And you do have a lovely smile, Avni. Oh. Take care.
Thanks for listening to this episode. If you've enjoyed it, please send me a comment on Twitter or Instagram at AvniTouch. Subscribe to Speak from the Body on iTunes or wherever you listen to your podcasts. Go to avni-touch.com/podcast to get the show notes. And finally, please head over to iTunes to subscribe, rate, and leave a review. It's very much appreciated. Thank you.